Surgeons warn of the risks of knee surgery. The removal of the menisci is too often practiced for no reason. It can lead to premature wear of the knee. Let's save the menisci. This is the cry of alarm launched by a group of surgeons to warn of the too frequent removal of this cartilage of the knee. An operation commonly performed but which involves long-term risk. A painful knee, as rusty, with the only prospect of regular infiltration or even the fitting of a prosthesis. This table normally reserved for the elderly corresponds however to the situation of thousands of patients in the prime of life. The reason? An operation performed 5, 10 or 20 years ago on the menisci, these two small crescent-shaped cartilages located in each knee, between the femur and the tibia, and which play a stabilizing and shock-absorbing role in the joint. If these interventions are sometimes necessary, we practice too many of them, and in a too radical way, whereas we could sometimes keep part of the cartilage, repair it, or even not operate at all, warns a group of orthopedic surgeons from the French Société d'Arthroscopie, SFA, on the occasion of the Congress of this learned society which opens on Wednesday in Rennes. A sometimes abusive operatio. It's very small and it's very frequent, which perhaps explains why the treatment of this area is trivialized, and, sometimes abusive, without the general public or the health authorities worrying about the subject, explains Nicolas Pujol, General Secretary of the SF. We want to train and inform surgeons, but also raise awareness among all players for public health purposes, patients, decision-makers, sports doctors, adds Yassine Carlier, member of the SFA board. The knee cartilage can wear out, sometimes prematurely, or tear in the event of trauma, fall on skis, car accident, etc. If a damaged meniscus can go unnoticed, the lesion can also result in significant pain, swelling of the knee or impeding the mobility of the joint. We can then stick to medical treatment, splint, rest, anti-inflammatories, rehabilitatio, or operate to suture the meniscus, remove the broken part or remove all the cartilage. As early as 2008, the High Authority for Health has recommended favoring the preservation of the meniscus when possible and performing an ablation, as partial as possible, when an intervention is necessary. But this is still far from being the case, in France as in many other countries, according to doctors from the SF. See also, what is the link between osteoarthritis of the knee and sleep disorders? Premature wear of the joint. According to them, of the 200,000 to 250,000 patients operated each year in France either on the meniscus alone or at the same time as the cruciate ligaments, only 5% undergo meniscal repair. However, at least 15% of the lesions could be repaired, estimates D. Pujol, which would make tens of thousands of additional patients who would keep their meniscus each year. The reason? Removal of the meniscus is an easier and less expensive operatio. In addition, the immediate consequences are positive, with less risk of having to operate again and faster recovery, which sometimes directs the preference of patients, especially among athletes, explains the head of the Orthopedics and Arthroscopy Department of the Hospital Center of Versailles. But in the long term, the absence of the small cartilage causes an increase in friction in the knee and premature wear of the joint, with a risk of chronic pain and a strong increase in the probability of the appearance of osteoarthritis. The surgeons of the SFA hope in particular for a financial revaluation of the suturing of the meniscus, which would encourage hospitals and clinics to practice it more. They claim that over time, this would represent a saving, by accounting for health expenses, painkillers, anti-inflammatories, prosthesis fitting, etc., and work stoppages avoid. According to an American study published in 2016, a meniscal repair would represent $2,400 less medical expenses after 30 years compared to a partial ablation, as well as a slightly longer life expectancy in good health.